Hello, welcome to Aging Well in America. I'm Anne Marie Gattari, your host. Every day, up to 10,000 people in the United States turn 65 years old. 5.5 million people today are aged 85 or older. By the year 2050, that number will grow to 20. 20 million people will be 85 or older. Are we ready? Is America ready? There's so much good work going on around the country and around our community right here. And I have with us today two of those people working on some of those good works. They're from the Epilepsy Foundation of Michigan, Arlene and Cynthia. Thank you so much for joining us.
Pleasure to be here. Thank you.
I want to start by just reading some symptoms and talk a little bit about what these might mean to some of our viewers. Staring into space, seeming out of it for a while, feeling disoriented or confused in places they know well, temporary changes in behavior like running, undressing, screaming, or acting very afraid, temporary problems with language, mumbling, saying things that don't make sense, confused memory, a sense of having lost time, being afraid they're losing their mind. These are just a few symptoms. My mother had dementia. Every one of these were applicable to her before she passed. But you're here to talk about another affliction that also carries with it this very similar set of symptoms, and that's epilepsy. Talk a little bit about how these symptoms are so easily confused and the problems when they are in fact confused.
Well, you know, most people when they think of epilepsy think about the person who's lying on the floor convulsing, and of course that is epilepsy, but everything you just read can also be symptoms of epilepsy, and that's why it's not the first thing you think of. I mean, epilepsy is a neurological condition, and these are seizures.
Right. Right.
So. And sometimes the first thing is not the first thing doctors think of. And we don't want it dismissed as a senior moment.
Correct.
And this is something that why we're out here, and we have a very good program called Seizures and Seniors that we're promoting.
Seniors and Seizures. This is a new program that you have that the Epilepsy Foundation has partnered with the CDC, you had said?
Yes, Centers for Disease Control.
It's an educational program that is fairly new. Why now?
Well, because most people think about epilepsy as a condition of childhood, but the fact is it's the largest growing group that is developing epilepsy happens to be seizures. I mean, it's almost like a reverse bell curve, where, and that's partly because of people living longer, but it's also because of traumas that people have had to their head that suddenly turn into epilepsy.
So epilepsy can be caused or can surface after a traumatic event that happened years earlier.
Absolutely.
Or stroke. I mean, the incidence of seizures increases tenfold within the first year after having a stroke. So that's why it's very important to get this information out to seniors so they can be self-advocates, or family members can be self-advocates for them.
Yeah. What do you do if you're having a seizure, or how do you handle it?
Well, first of all, there's many different types of seizures. And in the elderly population, one of the most popular, one of the most increased incidence is complex partial.
A complex partial seizure.
Right.
Which is what, please?
It means that there is, in the brain, neurons misfiring in one small area of the brain, and it may spread to the other area of the brain, but not encompass the whole brain.
Okay.
And therefore, depending on where it starts in the brain, where it spreads to, will give you the symptom of the seizure you have. Complex partial means it starts in a small area of the brain and can just spread to another. Thus, you have people who may start as oriented and then become disoriented, doing repetitive movements, what we call automatisms, repetitive behaviors, which is one of the hallmark signs of complex partial. The important thing to remember during complex partial is the person may look like they understand what's going on, but they cannot follow directions.
And how long does this period last?
It shouldn't last very long. They're usually very
minutes,
brief.
Seconds?
Minutes, seconds, yeah.
Yeah.
Complex partial tend to last 2 to 3 minutes, but you know, if they're on medication, that's a different thing. But still, they can occur. The important thing is not to grab someone, not to force them to do something during that time, not to yell directions to them. Guide them away from things. Sheep herd them. Keep them safe.
That's the main thing I think people
time it.
Yeah.
Time it.
And make sure it does not go over 5 minutes. In that case, then you need to seek medical assistance.
Okay, so a couple different things here. There's several degrees of seizures. There's some that are, you know, as you had mentioned earlier, Arlene, very severe. And there's a protocol, there's a first aid protocol for that. Can we talk about that for a moment?
For tonic-clonic, sure. Really the same principles, it's the same principles. Keep them safe. Take anything out of their environment that could possibly harm them.
Help them lie down?
You know, yes, if you're on a chair and you risk falling and hitting your head. I mean, there are people who develop head injuries because they've had a seizure and they hit their head. And there are people who have head injuries who develop epilepsy because of the head injury. So you want to keep them safe, keep them on their side, take anything away that would be harmful. I mean, you never know where you are when those things happen. And don't put anything in anyone's mouth.
Do not do.
Yeah, tonic-clonic seizures are convulsive seizures.
Right.
Okay, there can be convulsive seizures from other things other than epilepsy. But the first aid is still the same for the first responder. I always think of the T's. Turn, time, and tuck. Okay.
Turn.
Oh, turn them on their side.
Turn them on their side. Tuck something soft on under the head so they don't injure hitting their head, because people are convulsing, they're shaking, and they're stiffening, and sometimes the shaking can cause some head jerking, which can cause some injury. And turning them on the side prevents choking, because people are unconscious at that point. They have a lot of saliva. And if they're on their back, they will choke. So turn them on their side and time it. How many people wear a watch nowadays?
No, use your phone.
You have to
use their phone.
Yeah.
But the important thing is also look for a medical ID. If it says epilepsy, okay, we at least know the cause here. Okay, that's one. And most seizures from epilepsy are non-life-threatening if they're on medication, okay? But the important thing is to prevent them from injury, prevent them from choking, make sure it does not go on too long. After 5 minutes means something is wrong here. This is going on too long. So their medication isn't working. We need to call 911.
Well, yeah, there is it can be life-threatening, but only if it goes into, someone does go into status and it's way too long.
Why
Most
not
of them
call, excuse me, why not call 911 immediately?
Well, to be honest with you, if you don't know if the person has epilepsy, you might want to do that. But if you know the person has epilepsy, if 911 comes, they really can't do much. They'll take them to the ER and probably change their meds and or whatever, and the person will end up in the ER spending a lot of time and probably a large bill, possibly with no way to get home, and it really has done nothing to help them. So. Okay.
And so it's more important to be informed, to know how to handle.
To know how to handle. If you know a person has epilepsy and this is what's happening, you know, like Cindy said, the average seizure doesn't last more than 2 or 3 minutes. Okay. And you also have to recognize that when someone has had a seizure, it takes a lot out of them, and they might be a little tired and not quite themselves for a while. But that's not the seizure. That's sort of the aftermath.
I see. Okay.
People usually sleep after convulsive seizures, and no one gets up right away after a convulsive seizure and says, "Hey, I'm okay."
Go back to work.
Right.
And you have to remember, seizures from epilepsy can be different from seizures from other causative factors, acute causes. Epilepsy usually means there is no acute cause. It's something the brain wants to do. It's a disorder that's characterized by recurrent seizures. So versus somebody who has diabetes and maybe taking too much insulin and their blood sugar goes too low and they go into a seizure. That is an acute cause that needs to be corrected. In epilepsy, people live with this daily. Medication usually controls it, and the hard thing for a lot of people with epilepsy is, medical bills. They don't want to be taken to the emergency room and spend the day there for anything because, they don't want to have that fear of if they go out and I have a seizure, what will happen and I'm going to end up in the ER. Right. It can be very socially isolating.
But for seniors who this is the first time,
right.
I mean, it'll take the senior and possibly their caregiver or their family to really be educated and get used to these things.
We want to make sure people do go to the ER. If they have a head injury, okay, they suspect a head injury. If they're diabetic and they have epilepsy, okay, because we don't know which is causing the seizure. If it happens in water, all sorts of things.
Yes, if it happens in water, I can see
signs of injury, or it's lasting too long.
Yeah. So, talk to us a bit about the educational program that you're promoting, the Seniors and Seizures Information for Healthcare Professionals.
Well,
the main message here, the key message for the public.
Awareness, I think, is the point, so that people get the proper diagnosis, the proper evaluation, proper diagnosis, and proper treatment.
Right.
That symptoms are not ignored.
And treatment is medication? Is there other types of treatment?
One of the most important thing is analysis of what's going on and the testing, the EEG, the MRI, okay, to make sure, and to make sure that it's not something else that's causing the seizure. And therefore, after the diagnosis is made, in Michigan, we have some of the most key epileptologists, which are neurologists who specifically treat epilepsy.
Yeah, there are many in this area. At the major medical centers, all have epilepsy centers. And these are people who see epilepsy every day. I mean, you wouldn't want to have a heart procedure done by someone who does it once every 2 weeks.
Exactly, exactly. Yeah.
And with the elderly, because they may have other disorders, other medications, the specialist is essential because he will know the interactions between the medications, signs of toxicity, what would be the best medication for this person to be on with coexisting conditions.
I mean, there are other treatments for epilepsy, but medication is the first line.
Okay.
I don't know that they would consider surgery or some of the other devices at
Possibly
that point.
reparative if it was an issue that caused it.
Okay.
Right.
So besides stroke, what are some of the incidences or events that can lead to epilepsy?
Well, any
later?
kind of accident, car accident. We've had people with that's a biggie, but it could be virtually anything where you hit your head. I mean,
closed head
injury. I can think of a woman who had epilepsy who had a drop seizure at a movie theater and hit her head, and suddenly she's got a head injury as well as epilepsy. But someone could do that. Someone could drop for whatever reason, have the same thing happen. Gunshot wounds, domestic violence,
chronic alcohol use, anything that can injure the brain.
Right. Alzheimer's disease is also,
yes.
There's a higher incidence of epilepsy with people who have Alzheimer's. Now, I don't really know what the mechanism is, but we know the studies that are coming out are showing that.
Is that right?
Yeah. And I don't know if that's always recognized,
No,
probably. It may not always be recognized because, like you said, the symptoms look pretty similar.
Very similar. Talk to us a little bit about the foundation itself. It's got quite a history and it does some great things in the state.
We've been formed in 1948 in Detroit by a group of parents and health providers because there wasn't anything for epilepsy. And at this point, we're affiliated with a national group, the Epilepsy Foundation, and together we're really trying to bring more awareness about epilepsy because frankly, we want to eliminate it. We want to see a world without epilepsy.
How does that happen? How is it eliminated?
Well, part of that is through research.
Right.
Our goal is really to help people better manage the condition.
Okay.
And also to change the community enough so that people can live easily in it, so that they're not afraid to go out and live do whatever they want to do. And then the third leg of our stool really is research. We are hoping for the future. So.
Excellent. And you do this, of course, through donations, through fundraising?
Yes, we have a number of fundraisers. We do the Summer Stroll for Epilepsy, which is Pat at the Detroit Zoo, and where we'll have a wine tasting event in Birmingham in September. But you can certainly donate through our website. We would be happy to have you.
Yeah.
And we're happy to have people come visit. We have regular open houses. The next one is scheduled for July 23rd at our office.
Okay. And the phone number to call to find out about these events is on the screen here. It's the 800. I can't see that because I don't have my glasses on, but can you read? Is this at 800-322?
377.
Oh, no, I'm looking at the wrong one.
800-377-6226. You had the 2 2s, but in the wrong place.
Very good. There it is there, the 800 number and the epilepsy website address as well. Very good information on the website. I'm sure our viewers are interested to know what brought the two of you to this line of work. Cindy, I know you're a registered nurse.
Yes, and my father had epilepsy.
Okay.
And he was the type that if anyone ever develops it, don't you tell a single soul.
Really?
And the stigma that was with it and the issues that he suffered brought me to the foundation. And I felt who better can understand than someone who has a family member with it. And that, to me, is essential.
So if you wouldn't mind, tell us a learning from this. Is there a specific story or an event that you share with families to help them get over maybe some of the experiences?
I think it's essential that people with epilepsy get together with other people with epilepsy. No one knows what it feels like to have a seizure except someone who's been through the experience. No one knows what it's like to be on medication. And I think it's very vital that they talk to other people and form that bond in that community to get strength so they can come out and feel, be self-advocates. Strength in numbers.
And did your father do that?
No, he never did.
No.
And that, I think, is something that I think in this day and age you'd love to see the stigma of epilepsy and the diagnosis be gone. Treat it like diabetes, treat it like asthma. And sometimes that stigma is still out there.
Why is that? Why the stigma?
Well, because we don't talk about it. I think that's the main thing. I mean, people dredge up stories that they heard from 100 years ago. Our goal is to talk about it because we figure if we talk about it, put some air in it, it won't be so scary. You know, I think that's the main reason. You know, because it's been kept quiet for so long. But that's how cancer was in the 50s.
Right.
And sometimes too, I don't have epilepsy. I have a seizure disorder.
And the doctors
which is
try
the
to go
same
with the
thing.
flow.
Yeah. So doctors will call it something else
Sometimes
as
they
well.
will because they don't want to upset the patient.
Yeah.
For us, it's all the same.
What, excuse me, living with epilepsy is something that millions of people do, I'm assuming.
Yes, they do.
And how, several hundred million in the country.
Yeah, what are
we have over 100,000 people in Michigan who have epilepsy at least.
Of all ages?
We don't have really good data, but of all ages. About 30% are children.
Okay.
So,
is there an age when it is more commonly diagnosed?
Well, childhood, of course, and now seniors.
Yeah.
So those are the
with
two.
Children, though, is there a specific age range or?
Usually below the age of 10 is more.
Sometimes, depends. There's so many different forms of epilepsy, and some of them may not happen until high school. But in general, yeah.
And this is something then that these children will live with throughout their life?
Mostly. There are a few forms that resolve by adulthood.
Is that right?
Yeah. If you're lucky, you have one of those forms. But in general, it usually is a
or it resolves in their teens, goes into remission in their teens.
Yeah. Oh, okay.
But anybody can develop epilepsy or seizure disorder at any time during their life because of the multiple causes.
Right.
And we want awareness to be the key. We want schools to be able to handle it. We want rehab facilities to be able to recognize and handle it. And those are part of our goal.
Sure, sure.
And the community.
First responders, EMS, anyone who might come in contact with someone who's having a seizure.
We were talking earlier about the first responder and the law enforcement community and the importance that they have the right information.
Right.
Talk a little bit about that, because that could be something that I could see being a big issue for some of our viewers, whether their family member is elderly or not.
Well, that's true, and we have actually programs to educate all of those people for that reason, because if we don't educate them up front, what ends up happening is we have to help them on the other end when they've been badly treated. We do a lot of advocacy on behalf of people who've had problems because the police thought they were on drugs, or they thought they put them in a mental hospital when in fact they were having a seizure in public, and people just didn't recognize it. So we do have a program, and we are actively trying to educate all the police, the EMS, the first responders, which usually are police or fire, so that they have a better understanding of what they're seeing when they are called. So
your program is you're going to fire stations and police departments and speaking to their
and also to their conferences. Yes, but we've done whole police. You've done whole police departments.
Oh yes, I've done whole police departments. I think I've done Girls Point Woods. Yes, in your community. So it's just getting in there and them having the time to devote to this. And seeing the necessity of it. Schools now, we do a lot of schools too, because we have no school nurses anymore. And that's an urgency, and children go unrecognized or thought as behavioral conditions when actually it's seizure activity. So those are where we go to. And same in the nursing home facility. We don't want, or rehab facility, we don't want the symptoms thought of as something else. We want them properly diagnosed and treated. And you mentioned that you go to assisted living communities and you speak to administrators. I go and speak to administrators. I talk to staff, because they're the ones who are going to be seeing these clients in the home. Visiting nurses, social workers, anyone who has contact with the elderly and that are in that position to assist and help them. Gladly come in and talk to them. Great. Wonderful. What about the notion of if somebody has what they think might have been a seizure at one time, is it possible to have one once and then never have one again? And still do they still have epilepsy? Well, that's an interesting question, because the International League Against Epilepsy has been looking at that. We've always been taught that one seizure does not make epilepsy, but the International League is now wondering whether that's actually true. There's a little controversy about that. Clearly, if someone did have a seizure, they should probably go have it worked up. They've had one. Yes, they should have it worked up, because you don't really know what the potential is. And very often someone will have a seizure, and an epileptic seizure, and then they will have another one, and that definitely would be epilepsy. So. They look at things that may predispose them to developing the disorder with one seizure and go, yes, they have this and they have this. Let's really work them up, do a great history on them, do some testing and do some further investigation. What are some of the things that would predispose them? Well, if there's a family history, there definitely is a genetic component to this. Is there? There absolutely is. Okay. They've identified most of the genes. They just don't know what turns it on, because with genetics it isn't that you inherit the genes and you're absolutely going to happen, but something flips the switch, so to speak. What are other infections, encephalitis, meningitis, central nervous system infections, any head injury, closed head, open head, cerebrovascular accidents, all of those, stroke, TIAs, all those types of things to look at, that anything that can injure the brain can have the potential for developing a seizure disorder.
In children, of course, high fever, accompanied with a seizure, febrile seizures. That's something that may not be treated, but now they're looking at it more closely. So
lack of oxygen to the brain for some unknown reason. You know, all types of incidences like that. So.
Okay. But you know, the good news is we do have better treatments than we've ever had.
Yes.
You know, I mean, people don't realize that Dilantin, which was a major treatment for a long time, that a lot of doctors don't use anymore, didn't start being marketed till like 1938, and it was marketed by Park Davis right here in Detroit.
Is that right?
Yeah. But we have a lot more medications, a lot more treatments, and they have a lot less side effects, and so and the future looks really rosy. I mean, there's some really good new things coming down the pipe.
So people can call you just for general information.
Absolutely.
They can call you to come visit your facilities. And they can call you for a physician referral.
Definitely.
Yes, we'll give them several options depending on, you know, where they live and what their insurance is.
Okay.
But we have a very rich community now in Michigan, which didn't happen years ago. Years ago, there really wasn't much. There was like one. Actually, we had one epileptologist in 1948, and he was employed by the epilepsy by us.
By the foundation.
But now, you know, it's a much richer environment, and so it's a good time.
Well, that's wonderful. Well, you are doing some tremendous work, and I think this is really important. All the information, the fact sheet on seniors and seizures, the informational cards, and I'm sure there's lots of this information also on your website.
Yes,
so people should look it up and call with any questions. So,
definitely.
Well, we have come to the end of another 30 minutes, another episode of Aging Well in America. As always, we invite our viewers to send information, to send topics of interest that they would like us to explore on our program here at the Grosse Pointe War Memorial. Thank you, and we'll see you again next time.